Hello, today I'll be talking about mycoplasma pneumoniae, which is a bacteria that I had chosen for this presentation. This bacteria is going to lack a cell wall and it is usually gram-negative. It has a plumoric shape, which is going to alter its shape and size regarding its environment. It is a strict aerobe, needs oxygen to survive and to thrive. It grows very slow in regards to most bacteria. It usually has a 1 to 3 week incubation period and is very small, which makes it hard to see on a gram staining. This bacteria causes respiratory tract infection. Like most tract infections, you're going to want to get it treated as soon as possible before it becomes something worse, left untreated. This bacteria can cause damages to the lining of your respiratory tract, your throat, your windpipes, your lungs. And since all your ears, your nose, and your throat are all connected, it can cause further problems to those parts of the body as well. But if left untreated, it could result into pneumonia or bronchitis. That's going to be a lot worse to deal with and a long hospital visit. It is very common in young children and adults. It occurs worldwide. It has its sporadic moments, also epidemic moments, depending on the time of the year, if there's large events and large groups. With that being said, this is an airborne transmission. Coughing, sneezing, talking too close to someone, you're going to contract this microbe. It is very common, like I said, in public settings like schools, therefore you're getting it more in young children, concerts, hospitals, anywhere that there's a large group of people and someone has this, you're probably going to get it. A good way to prevent getting this is having good hygiene, washing your hands, coughing, sneezing into your elbow, generally staying away from people who are infected. If you hear someone saying they're sick, just don't go up to them. There's no vaccine for this, and there's no word about they're creating a vaccine. Probably just the fact that it's very common, like a common flu. It is resistant to B-lactam antibiotics such as amoxicillin. Those really target by breaking down those cell walls and killing the disease. And like I said, this bacteria doesn't really have a cell wall. It's not that it's going to be resistant to that. So microlides, especially azithromycin, is a common antibiotic with young children. And regarding adults, it's going to be tetracyclines. Sorry, these words are really big. Even fluoroquinolones. These are going to disrupt the enzymes that enable the bacteria, help the bacteria grow and whatnot. It has adhesions which allows to firmly attach to those respiratory epithelial cells, and it has the ability to invade immune response. These are going to damage your epithelia tissues and really stick there and cause damage. The enzymes that this disease has are glycerol 3-phosphate, has oxidase, it produces hydrogen, has glycerol kinase. All these enzymes are really going to allow that disease to cause damage if not treated as soon as possible. Toxins related to this bacteria is the CARDS toxins, which is a community-acquired respiratory distress syndrome, which, like I said, is in a community that you're probably going to get it. Those symptoms that you're going to feel are a dry cough, sore throat. It gives you a low-grade fever. You're going to get headaches. You're going to get fatigued. You're going to get chills, sometimes ear pain. As I said, since your throat, your ears, and your nose are all connected, it can also be affected. You're going to have shortness of breath. A lot of people have a dry dog cough. It's just a loud and nasty cough. With all that being said, mycoplasma pneumoniae is definitely can be worse for you if you don't get it fixed when it needs to be, but like I said, you get it fast, you can get rid of it fast if all those methods of treatment are done. Thank you.